Hey, Yaz, this is really incredible, and I'm so proud to have been a part of this project. The genesis of it is that the medical unit was sitting around during the measles outbreak in Gaines County, Texas, which I'm sure you remember, and they were thinking to themselves, how can we broaden this out and take an interesting look at where vaccination rates stand around the country? They then embarked on this 6-month-long project where they reached out to every department of health in every state in the country to get this county-by-county data about vaccines and vaccine rates among children, specifically kindergartners. Now, to gather that amount of data, it wasn't like these departments were, hey, I'll just send you an email and you'll have it. This was phone calls after phone calls, FOIAs. And what they have essentially compiled here, really remarkably, is a county-by-county look at the entire country and vaccination rates all across the country. They worked together with researchers at Stanford University to crunch the data, and they came up with some interesting stuff.
I want to talk numbers if we can, Steph, because I think the numbers kind of really tell the story. Since 2019, you had 77% of counties and jurisdictions that have seen a decline in their vaccination rates. That's a huge number. And then among the states that are collecting MMR data, which is measles, mumps, rubella data, 68% of counties and jurisdictions now have rates below 95%. That's the target vaccination rate for herd immunity. Walk me through some more of these numbers that you've been seeing in this study.
Yeah, sure. I mean, the other big number is not only did they look at vaccination rates, they looked at exemptions. Now, in school districts for children, most states require kids be up to date on their vaccinations, or they can't attend school unless they have an exemption. And exemptions can be given for medical reasons, but they can also be given for religious and philosophical reasons. And according to the numbers that our team dug up, 53% of counties and jurisdictions saw their exemption rates more than double from their first year of data to their most recent. And that's a pretty remarkable number, too. So that means children are going to school, they have an exemption, but they are not up to date on their vaccines.
So there's a couple things that you said in there that I think are really important. One is that it's not just medical exemptions. It's for religious and or philosophical reasons in which they could have exemptions for actually getting these vaccines. Do we know why it is they're allowing this to go forward?
Well, look, the tone and tenor of, first of all, this administration coming straight from RFK Jr., but nationwide, there is a growing vaccine hesitancy. And you know that when you go online, and particularly through social media, you hear a lot of people out there raising questions about the safety and efficacy of some of these vaccines that have been around for a very long time and have actually prevented certain diseases, measles among them, polio and others. And you combine that with a place like St. Louis, and this is interesting. I traveled there and did some interviews there. In lower income areas, access to vaccines is difficult. So you have to really make an effort. Sometimes that means people not going to, parents not going to work to get their kids vaccinated. They don't get paid that day. You combine that with a general hesitancy, and that's, in some cases, what is creating this dive in vaccines. Now, let's talk about St. Louis for just a second. St. Louis, among kindergartners, the numbers have dropped from 2010 to 2024 for the measles vaccine, have dropped from nearly 90% to 74%. Now, that is lower than Gaines County, Texas, where that outbreak took place. And if you think about a city like St. Louis, if they had an outbreak of similar proportions in St. Louis, in Gaines County, it was 100 people hospitalized and 2 children who lost their lives. In St. Louis, those numbers get much, much bigger very quickly.
And the thing is that in St. Louis, I know that kids are required to be vaccinated when going to public schools, but it seems as if in your reporting and what NBC has found out is, in fact, some of these schools are turning kind of a blind eye to this because they don't want to lose federal funding.
Yeah, there are a couple of things going on there. The school district answered some of our questions over email, but they did not sit down for an interview with us. But our team made contact with the head nurse and had a conversation with her about the situation there when it comes to following the vaccine mandates for the schools. And what she said is that the situation is so bad that it would mean potentially in some schools, hundreds of students not allowed to go to school. So you have these school administrators who are saying to themselves, where are our priorities here? Are we really going to send these kids home? That's part of it. And then if they do, and the numbers are in the hundreds, then a school district that's just scraping by as it is could potentially see their funding drop on top of it. And what they're not hearing in that community is anyone in a leadership position who is looking at these vaccine declines and saying that this is potentially a problem. It is just not talked about.
Is the sense, Steph, that this is just going to get worse if you're looking at these numbers, and especially places like St. Louis, which is not even reaching herd immunity at this point?
Experts say it is a matter of time before we see another outbreak. And there are a lot of people that we spoke to in St. Louis that are concerned, including an incredible school nurse who said that she's concerned that it's going to take something like that in a city like St. Louis for people to pay attention to what's going on here.
Thank you.
Thanks for the time. Appreciate it.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.